heard time and again, early screening for cancer is the best bet for survival. The recent death of actress Kirstie Alley due to a brief battle with colorectal cancer brings early detection into renewed focus and coincided with National Cancer Screening Week, which was last week, so we're just going to carry it over. Dr. John Stewart, the director of LSU LCMC Health Cancer, joins us this morning to talk to us about the importance of cancer screenings. Thank you so much for being here.
Thank you so much for having me.
So we know that Cancer Screening Week was last week, but it's important to kind of recognize that, the importance of cancer screening year-round.
Yes.
Tell us why it's important to just make sure that you're talking with your doctor and getting looked at.
Sure. So cancer screening is a shared decision. And so you have to really weigh the benefits and the risk of cancer screening based upon your profile. So what drives the profile? Number one is family history. Although we know only 10 to 15% of all cancers have a hereditary component, it's important to understand how that hereditary component plays into your cancer screening. Now, if we think about what happens in Louisiana in particular, we know that there'll be more than 9,600 deaths from cancer in Louisiana for this year. Furthermore, we'll have about 28,600 new cases of cancer diagnosed this year. So it's important for us to make sure that we get the word out that cancer screening saves lives.
That's so interesting, and I was looking at some of the information that you shared with me earlier. Louisiana has the third highest breast cancer rates, and we rank 45th for early lung cancer detection. Do we know why that is, or is it just, those are the statistics?
Yes, and so the statistics for both of those cancers, such as breast cancer, that has a longer history of understanding how mammograms influence the stage at which a patient is diagnosed, i.e. early breast cancer or late breast cancer. We also understand now that patients who have a smoking history might benefit from what we call low-dose CT scanning. In other words, a patient comes in and they get a CAT scan that has low amounts of radiation, and they can detect early lung cancers.
Interesting. Well, let me ask you this. There's so many different cancer diagnoses out there. How do you know what you should be looking for? Maybe if you don't know your family history, but you definitely don't want to get ill, how do you know what you need to look for?
Yes. And so the general recommendations for cancer screening are based upon individuals who have an average risk, i.e. they don't have a family history, they don't have certain conditions such as ulcerative colitis that might increase their risk for cancer. And so, this also plays into the fact that it is extremely important for you to have a relationship with a primary care physician, okay? And so this needs to not be a transactional relationship where you come in, you get your blood drawn, and you leave. No, it needs to be more of a health coach relationship in which they will guide your screening and make sure that you get the appropriate recommendations for cancer.
So step number one, get a physical, just a normal doctor that you can have that relationship with.
Yes.
And start talking about a plan for moving forward.
Absolutely.
Okay, and of course there's a lot of online resources, for finding insurance coverage, among other things.
Yes. And so information that was released last week on www.cancerscreenweek.org has so many resources around, number one, accessing cancer screenings if you're uninsured or underinsured, and number two, laying out the most recent recommendations for these screenings.
All right, so it's good to get ahead of it.
Yes.
Get ahead of it and know your health and have that relationship with your doctor.
Absolutely.
All right, Dr. John Stewart, thank you so much for being here this morning. We
appreciate
it. Good.